In this video, we're going to be talking about the treatment of coronary artery disease. So let's say you are the doctor, right? And you have a patient that comes in, and after all the processes, all the history taking, lab tests, and all the kind of scans and everything you did, you determined that this patient has coronary artery disease. Now you tell him and he's like, what now? Like, what's the next step? What do you got to do? So now that you've diagnosed him, let's first just quickly review what it means to have coronary artery disease. So if we look at this patient, we look at his chest, we zoom in to the heart, we know that the heart has all of these big vessels going out, supplying the body and everything like that. But also it has these little vessels called coronary vessels, right? And these vessels supply the heart muscle itself, right? It makes sure that these muscles can get all the oxygen and stuff they need to be able to contract and work properly. So during coronary artery disease, these coronary vessels can get obstructed for some reason because of an atherosclerotic plaque, which is basically fat depositing in the wall of the arteries. Then what this does essentially is it occludes, kind of restricts this vessel so that now blood that's supposed to flow down here and supply the rest of the heart, this blood doesn't flow so well, so the heart cannot receive blood as much as it should. Now, besides having a fatty streak or an atherosclerotic plaque like this, it can get worse. These plaques can rupture and cause a thrombus to be formed, kind of like this. So if this plaque ruptures, we can have this aggregation of platelets and basically a clot, a thrombus. Now this is even worse because now the obstruction could be even greater, maybe like 90 to 100%, leading to complete stenosis. Okay, so now the muscle gets no blood at all and may actually die, right? So just like this, maybe now if this vessel is occluded, this part here will get no blood, get ischemic, and die by necrosis. So we're going to basically, remember, this patient, the different kinds of coronary artery disease can include acute coronary syndrome or just simple a stable plaque, right? But we're just going to assume that we're talking about all kinds of coronary artery disease, right? So what do we do next? What we can do is start off with medicine. Medicine is not ideal because it's not really solving the problem, as you'll see shortly. But most patients don't want to do surgery straight away. They want to try medicine, right? Because they're a bit afraid of surgery. So regarding medicine, what can we do? There's a couple things. And the best way to think about it is by looking at this picture. So again, here we have this vessel, this coronary artery, right? And right next to it, here we have this muscle. So we have this myocardium, the muscle of the heart. And this vessel is supplying this muscle, right? But look, it's occluded. We have this fatty streak here, this atherosclerotic plaque, and it's ruptured, and we have this thrombus, this platelet aggregation, and we have a super tiny lumen. Only a little bit of blood can flow through, and this is the muscle of the artery itself, right? So what can we do? What can we do? We can reduce this thrombus formation. How? We can reduce this thrombus formation by taking many kinds of drugs. The one I'll talk about is aspirin. Aspirin is a drug that inhibits COX enzymes, right? Don't think about, I know what you're thinking about, but not that kind of COX, right? It's a COX enzyme, which basically, by inhibiting this enzyme, we inhibit the formation of thromboxane. And thromboxane is a molecule that stimulates the aggregation of all of these platelets, making a thrombus. So, therefore, by doing this, we can reduce this thrombus formation and thereby having a bigger lumen, right? What else? Look at this fatty streak. What if we can prevent the formation of this fatty streak, prevent the formation of atherosclerosis? In doing so, we could prevent this rupture because this rupture only happens because this fatty streak is growing too big. So what we can do is reduce atherosclerosis, reduce this fat deposition by taking drugs such as statins. By taking statins, we can reduce LDLs. LDLs are low density lipids, right? And they are the ones that typically tend to deposit right here. What else can we do? We can do something very special, right? So we know the heart muscle depends on oxygen, right? But because of this stenosis, because of this blockage, the oxygen supply is very low, right? Even though the oxygen demand is still the same. So we want to reduce the oxygen demand by the heart and increase the supply. Thereby, we can reduce death and ischemia. So one drug is nitroglycerin. Nitroglycerin is a drug that can dilate these coronary vessels, thereby improving the size of the lumen. It can dilate this vessel, improving the oxygen supply. And not only this, nitroglycerin can dilate venous vessels, so it can dilate your inferior vena cava and all those kind of veins, and thereby reducing venous return. If we reduce venous return, we reduce the preload, and by reducing the preload, we reduce the amount of blood that the heart has to pump. We reduce the amount of work that the myocardium has to do, and therefore we reduce the amount of oxygen that it needs. Okay, so that's how we can reduce the oxygen demand as well. Now, there are many other ones which I'm not going to mention because this should just be a short video. Now, okay, now we talked about medicine, but this patient, he's like, he's refractory, he's not responding to this medicine, he's having a lot of pain, and he's developing heart failure. This just means that these drugs aren't working. It's not working for the patient. So in this scenario, what we got to do is go to surgery. What can we do? We can do something called the PCI, percutaneous coronary intervention. Okay, what does that mean? We're actually going to go in here and solve this problem. What do I mean by it? So normally, right, this vessel is occluded, so the muscle isn't getting its oxygen. It's starting to die. So what we can do is give a percutaneous coronary intervention, and that means you take a little pipe, a catheter, you put it in one of the vessels, for example, the femoral artery. You put it in there, and you sieve it all the way up to the heart. You put it in the heart, you come up here through the aorta, and you put it into these coronary arteries. You basically find the coronary artery that's occluded. So let's say we've put this pipe in, we find, oh, it's occluded here. Now what you do is you do an angiography, which is like basically putting this pipe in and putting a balloon in there and dilating this balloon. By dilating this balloon, we remove this whole thing. We squish it to the side, opening up the vessel. After you do that, you can put a stent, which is something that will keep it there. Let me show you. So here, we put in the balloon, we dilated, we pushed everything to the side, opening up the lumen, and then we put this metal-like thing, a stent, that basically keeps it open like that. So now the blood can flow freely. Hopefully now you restore the blood flow to that area. Very importantly, this needs to be done in 90 minutes. We call this the door to balloon time. If it takes more time than this, the moment the patient gets in the hospital, from the moment it gets this done, 90 minutes. If it takes more than this, it has been shown that the mortality rate or the death rate increases significantly. Now, what else besides PCI? We can also do another thing. Instead of going and fixing this problem like we just did with PCI, we can do something else that's pretty interesting. So again, we have this ischemic area that's lacking blood supply. What we can do is we can take a vein or an artery from another part of your body, let's say your radial artery from your arm, or your saphenous vein from your leg, or your internal thoracic artery, any kind of artery that could be used. You take it, you shove it into this aorta here, and you make it bypass. You make it bypass this occluded area. So now the blood can flow directly from the aorta through here and apply this area. Because normally, right, it's supposed to flow through there and then here. But now this is occluded, so you're bypassing it. So now, even though this area is occluded, this area is still getting the blood it needs. Okay, so what do we call this? Now the area can get reperfused and hopefully recover. We call this a CABG, coronary artery bypass graft, because you're bypassing this occluded coronary artery with a graft, okay, with another vessel. So now that you've done all these things, these are the key things you could have done to help a patient with coronary artery disease. So problem solved. But normally for patients, it doesn't stop there. This is a problem that will stick with them their whole life. They would most likely have to be aware of it because it can reoccur. You can have a problem with these stents. You can have a problem with the grafts or whatever. So they always have to be aware of this. It's always going to be on their agenda, but that is beyond the scope of this video.